So, TXA has been proven to reduce the chance of death in the event of a postpartum hemorrhage. A little bit about how it works. So, when bleeding occurs, a clot forms by building up of fibrin. After the clot has served its purpose, the plasmin breaks down the fibrin and dissolves the clot. This can be problematic if it happens too soon. So, TXA is actually a synthetic antifibrinolytic agent, and it inhibits the breakdown of clots, therefore stabilizing the clot, and it reduces the chance or reduces bleeding in the uterus so that it can maintain hemostasis. So studies show that TXA is only effective if it's used early. It should be used within the first 3 hours from birth. There can be a second dose given if bleeding continues after 30 minutes. And the only time it can be used after 3 hours after birth would be if it was a second dose being given within 24 hours and that first dose was given within the first 3 hours. So TXA is given intravenously. It would be 1 gram of TXA, but we're going to dilute this into 100 cc's of 0.9% sodium chloride and administer this over a 10 to 20 minute time frame. Anything more than 1 milliliter a minute can actually cause hypotension, and we want to make sure that we don't mix this with anything containing any bag containing penicillin. I thought this was pretty interesting that every 15-minute delay in administration was actually associated with a 10% reduction in the benefit against bleeding related deaths. So it's contraindicated if somebody has a thromboembolic disorder or they're already taking an antifibrinolytic medication. We shouldn't see this in out-of-hospital midwifery care, but it is good to know. If they have a known allergy to TXA, one big one that we might see is that somebody has defective color vision. The reason is that one of the serious side effects is actually impairing color vision, and so that could perpetuate and make that worse in a client that already has that. Other serious side effects are seizures, pulmonary embolism, deep vein thrombosis, anaphylaxis, and as well as other visual disturbances. Minor side effects would be headaches, backache, abdominal pain, nausea, vomiting, diarrhea, and fatigue.